Robotic-assisted joint replacement surgery is now available for partial knee replacements, total knee replacements, and total hip replacements. Robotic-assisted joint replacement is different than traditional joint replacement surgery by virtue of the fact that it provides a level of accuracy and precision that manual instruments cannot. Any patient who's a candidate for a partial knee replacement, or total hip replacement is a candidate for robotic-assisted surgery. There are really three facets to this technology. First, robotic-assisted surgery starts outside of the operating room, where there is extremely powerful three-dimensional preoperative planning, which allows the surgeon to know exactly what size components and what alignment is desired to achieve before the operation is ever even performed. Secondly, it allows for a level of precision in actually performing the operation that traditional manual instrumentations did not. And third, it allows for a level of intraoperative customization based upon patient-specific features that were not available with traditional technology.